All right, so you're a nursing student, you're staring down your exams, and you see public policy on the study guide. And you're probably thinking, what does this have to do with my job at the bedside? Well, it has everything to do with it. This explainer is going to be your ultimate study guide, breaking it all down from the theory to the real-world action. Here's how we're going to tackle this. First, we'll get the basic definition down pat. Then, we'll connect the dots to see why policy is so important for patient health. After that, we'll walk through the actual policymaking cycle. This is a big one for your tests. And finally, we'll get to the most important part, your role as an advocate and how you can actually get involved.
Okay, let's dive right in with part 1. This is the foundation for everything else, and a concept you'll absolutely need to know for your exam. So, what on earth is public policy?
Think of policy as the official rulebook. It's the set of principles and actions that guide how governments and organizations make decisions and hand out resources. But here's the key point, and you'll want to remember this. Policy isn't just about what governments do. It's also about what they choose not to do. That inaction, that's a policy decision too, and it can have massive consequences.
So why is this a core part of your nursing education? Why does this matter so much? Well, let's connect these kind of abstract rules directly to the health of the people you're going to be taking care of. You see, policy is like the invisible architecture that shapes our daily lives. You might not notice it, but it's everywhere. It's the reason you have, hopefully, safe roads to get to work, clean water coming out of your tap, and public parks in your neighborhood. All of those things are the direct result of public policy.
To really get why this is so important, let's do a little thought experiment. What would our world actually look like if all of this policy stuff just vanished?
Yeah, it's not a pretty picture. We'd be looking at a world without universal health care. A world where access to care is wildly unequal, where there are no safety regulations for things like drugs or vaccines. We'd see lower wages, more dangerous working conditions. The list goes on. Simply put, society would be a lot less safe, a lot less fair, and a whole lot less healthy.
Okay, so this is the big one. How does a problem out in the world actually get turned into a policy? It's not random. There's a process. And this 5-step cycle is a core concept you absolutely need to nail for your exam.
So here's the blueprint. It starts with agenda setting, just getting a problem noticed. Then comes policy formulation, which is brainstorming solutions. Third is decision-making, where a choice is made. Fourth is implementation, putting that choice into action. And last is evaluation, where you ask, did it work? To make this stick, let's walk through it with a real example, mandatory bike helmet laws.
Step 1, agenda setting. So a report comes out with this shocking statistic. Nearly 3/4 of cyclists who died in Ontario over a 4-year period were not wearing a helmet. That kind of hard data, that evidence, is what gets an issue onto the government's to-do list.
Okay, step 2, policy formulation. Now that people are paying attention, the experts get to work. They start proposing solutions. Maybe we focus on primary prevention, like building separated bike lanes to stop accidents from happening at all. Or maybe we focus on secondary prevention, like a helmet law, to reduce the severity of injuries when accidents happen.
Next up, decision-making. This is the moment of truth. The policymakers look at all the research. They have to weigh the pros and cons. Sure, helmets reduce head injuries, but will a mandatory law actually stop people from biking? It's a balancing act.
And once that decision is made, we hit step 4, implementation. This is where the policy becomes real. A law gets passed. But it's more than that. Money has to be found for things like public awareness campaigns, and police need to know how to enforce the new rule.
And finally, step 5, policy evaluation. You have to check if what you did actually worked. So studies are done, and in this case, they found that, the laws can slash severe brain injuries by a huge margin, up to 80%. But they also might find that it discourages some people from riding. That new information then feeds right back into the system, and the cycle can start all over again.
All right, so you've seen this big, complex cycle. Now, where do you, as a nurse, fit into all of this? The short answer is one powerful word: advocacy.
Advocacy is your tool for change. It's about taking what you know from the front lines of healthcare, your expertise, your experience, and using it to push for better policies and practices. It's about using your voice to fight for health equity.
And here's the most important thing I want you to take away from this. You are already an expert at this. Think about it. What do you do every single day? You assess situations, you communicate with patients and families, you plan care. Those are the exact same skills you need to be a powerful political advocate. You've already got the training.
And the best news?
You don't have to figure all this out by yourself. There are amazing professional organizations out there, like the RNAO, whose whole job is to help you get involved. They provide the toolkits, the support, and the collective power to make sure your voice is heard.
Okay, so let's get practical. Let's talk about the concrete things you can do, starting today, to become a nurse advocate.
This doesn't have to be some huge, intimidating thing. It can be as simple as joining your professional association or responding to an action alert email. That takes, 2 minutes? You can talk to your neighbors about a health issue. You can write a letter to your elected representative. You can speak up at a meeting. Every single one of these things counts. It's all political action.
And if you ever feel like one person can't make a difference, just remember this number. There are over 300,000 registered nurses in Canada. Imagine that. Imagine the incredible, undeniable power of that collective voice when we all speak up for health.
So as you're studying for your exam, and as you're getting ready to start your amazing career, I want you to think about that question. What's the one issue you're passionate about? Because your voice, your expertise, and your passion, they have the power to create a healthier future for every single one of us.